All right.
And we are live.
Yes, okay. All right, awesome. Hello, everybody. It's Dr. Alex Earle, and it's Hump Day with Dr. Alex Earle. That's right. This is the time I get to spend with you guys and answer all your plastic surgery questions. And we are here at Pure Plastic Surgery today. And before we hop into all those questions, as you know, I like to talk about some sort of plastic surgery topic, just give you guys some more information. So today we're going to talk about everything that has to do with skin tightening, okay? So we'll go over that real quick. We'll talk about all the different devices that we have here at Pure. And then after that, I'm happy to answer questions about skin tightening or really anything else regarding plastic surgery, okay? From head to toe, from pre-op to post-op, all right? Okay, so skin tightening, right? This is something that we get asked about it a lot, okay? Because we know we do a lot of body contouring, and also because people are getting more and more worried about their skin, mostly having to do with the GLP-1s, right? Those are the injections, right? The Ozempic, the Mounjaros, okay? So those injections have shot up in popularity. So people are starting to lose a lot of weight. And that is awesome because it's a lot better for you. You're healthier. If you're a pre-diabetic, you don't become diabetic. You control your blood pressure. There's all sorts of health benefits to losing the weight. But there's a downside, right? And you guys know what that is. Unfortunately, the downside to losing the weight is that the skin becomes loose. And so you may have heard these terms. You may have heard of terms like Ozempic face, Ozempic butt, just loose belly skin, right? And so these are the things that happen when you lose weight, especially as you start to get up there, right? If you lose like 20, 30, 40, 50 pounds, you're gonna have a lot of excess skin, and it can happen in all areas. It can be in the face, the neck, the chest, the abdomen, of course, the arms, the thighs, the back, okay? And so then we have to figure out, how are we gonna treat these areas? Is it severe? Well, if it's severe, then we have to do some sort of surgery, right? We got to cut it out. So, for example, if it's severe in the belly area, we got to do a tummy tuck. If it's severe in the arms, you got to do an arm lift, okay? Severe in the face and neck, we do a face and neck lift, etc., right? You get the point. However, what happens if it's not severe? What if it's kind of mild or like low moderate? Well, what can we do then? Do we have to do a tummy tuck or an arm lift? Do we have to put all those big incisions and scars all over the place, right? So that's where this comes in. Okay, so first of all, that's a very important point, right? It's not for everybody, all right? It is for those that have mild to low moderate excess skin. If you have high, moderate to severe, you're gonna need surgery, okay? All right, so what do we have here? So we have different options, and the good news is that here at Pure Plastic Surgery, we have pretty much all the best options and anything that you can think of or imagine, okay? So we have a few machines that we use here in the operating room, and so we have our BodyTite, we have our J-Plasma or Rejuvenate, and we also have the latest, basically the latest technology in terms of RF skin tightening, which is part of the BodyTite family, which is called Quantum. And this is like the latest technology there is. So basically, all the latest technologies are here. And then if we're going for like more minimally invasive, something that we do in the clinic setting under just some topical kind of local anesthetic cream that you put over the area, then we also have your Morpheus 8, which is your radiofrequency microneedling. Okay, so then, because we have all these options, sometimes then it becomes a little bit confusing. Like, hey doc, what should I use for what? I don't understand which one is better, etc., etc. So, honestly, the truth is that all of these three do pretty well in terms of skin tightening, but some of them are more powerful than others, okay? So certainly the J-Plasma and the Quantum are gonna be the most powerful ones that we have, okay? And so these can definitely hit some of those people that are in that kind of that low, moderate, moderate amount of skin laxity. Certainly the ones that are mild, all of them will hit the mild. But these, if we're gonna go up a level, we're gonna get into that moderate range, then we're talking about these two right here, the J-Plasma and the Quantum, okay? If we're talking mild, then we're talking like BodyTite, or like if it's super mild, then of course the Morpheus. Now, what type of energy do they use? Well, actually, all of these use the same type of energy, which is called RF or radio frequency type energy. So that's what I have kind of circled out here. So RF, they're really all RF energies. Okay, they just come in a little bit of a different format. So the body type, now this one I like to use nowadays for a small area. So it's really probably the best one for the chin. It's the best one for the chin because of the fact that it's not so powerful. And of course the chin is a very, it's a very complicated area. It's an area that you have to be very careful with. You want to minimize any sort of potential complications here. There's a lot of very important structures going through the neck area, right, into the head and neck. And there's a lot of nerves there that are relatively superficial that you want to try to avoid injuring, okay? So that's why I think the body type, and actually specifically when we're doing it for the chin, is called face type. But that's the one that I recommend for that area. It helps really, kind of retract that skin up, give you a little bit of a sharper angle between the face and the neck, and a sharper angle here at the angle of the jaw. And I typically recommend face type for pretty much anyone that's considering liposuction of the chin. Of course, we combine all of these with liposuction. So the lipo goes first, we remove all the excess fat, and then we help the skin along. And in this case, we can help it along with the face type, all right? Now, if you're looking for, those patients that have a little bit more skin laxity or larger areas, then we're talking about the J plasma or even the quantum. The J plasma also uses RF energy, but it combines it with this really cool plasma state made from helium gas. And so it helps basically amp up the heat so that we have more skin tightening. And so with the J plasma, you can potentially get up to 60% skin tightening with this product. And so that we like to use for, I guess, again, larger areas like the abdomen and the back and maybe the thighs and the arms as well. It works well for big areas, okay? And you may have heard about that. A lot of people talk about J plasma and Renuvion, okay? It does have that helium gas, so for that reason, I definitely don't like to use it in the head and neck area. So because I don't want to insufflate this area with a whole bunch of gas, okay? So I don't use that for the head and neck, but it can certainly be used in the body. And then this is the latest technology, quantum. It basically has the most power, the most heat. It can do everything that J plasma does, but it does it faster and quicker. It's really, really efficient. And it doesn't involve the gas, so no need for gas there. So that's the one that is basically come out the most recent. And you probably haven't heard me talk about it a lot yet because we actually just did our first case yesterday. That's right. We did our first quantum case and we're super excited about it. And we're looking to do, of course, a lot more here in the coming weeks and years. Okay? And then if you have mild and you're just looking for something to do in the clinic setting, no need for anesthesia, no need for lipo or anything else, then you can use your Morpheus, which can be done anywhere in the body. So in the face, the neck, abdomen, anywhere basically. There's Morpheus 8, there's a smaller one for like the face and the neck, and then there's deeper ones and a more powerful one for the body. And we have those available as well. The downside to the Morpheus 8 is that it's not just one treatment. Okay, so these ones up top, it's one treatment. Okay, one and done. Sometimes you may have to touch it up, but really for the most part, it's one and done. This one here, it's not one treatment. It typically involves anywhere between 3 to 6 treatments, okay? And they're spread a month apart. And that's when you're really gonna see the results, all right? So 3 to 6 treatments, and I'll write that down here, but this is gonna be 3 to 6 treatments spread 1 month apart, okay? All right, so I wanted to do a little show and tell. So the body type is this first one here. So that's the one that we're talking about here. Specifically, we're doing it for the chin. It's actually called face type, but it's the same machine and the same technology. Here is the body type, okay? And then over here, I just want to show you what that J plasma cannula looks like. And I don't know if you guys remember, we were showing you the machine that we unveiled not too long ago, the Aeon, which involves the J plasma. So this is what the J plasma cannula looks like, okay? And so this actually goes underneath the skin, right? So the cannula goes underneath the skin. Here at the tip is where the gas comes out. So you have that helium gas plasma, as well as the RF energy. That's what's gonna help bring the heat. It's gonna help tighten up that skin. And then of course that connects to the big machine that if you guys have been following me, I presented a few weeks ago called the Aeon, which is basically the R2D2. It has just about everything that you could want in it. It has the liposuction, it has the suction, it has the baser, it has the power assistance, and everything else, okay? So that's the one from Renuvion, the J plasma, right there. okay? And then the new kid on the block, Quantum. There you go. So this is a new kid on the block. I'm really excited about this. And so we'll let you know a little bit more about this as we move along. Okay? All right. Awesome. So that is the presentation for today. But of course, I'm happy to answer any questions. But before we do that, before we jump into your questions, I have a big announcement. All right? Because, today we're talking about skin tightening, but and we're talking about, liposuction and things like that. But one of the procedures that has been getting the most attention lately is actually the eyelids. That's right. So it's pretty incredible. It used to be that breast augmentation was the most popular procedure in the US, and then liposuction, and now pretty close to liposuction is actually eyelid surgery. And so that's becoming super popular right now. The upper lids are probably the most popular, but also sometimes the lower lids as well. And we have a special going on for that with our very own Dr. Vidal, and you can probably see here, can you guys see that over there? All right, so we're super excited. We want you to get blephed up, that's right. So if you've ever been thinking about rejuvenating the eyelids, making the eyes area look younger again, and we can literally take off about 10 years just by addressing the eyelids, okay? And of course, I don't do this myself. You guys know I'm kind of a body guy. So, the highest I go is to the chin, right? When I do that face tight or that chin lipo. But Dr. Vidal, she's great with everything related to the face. And she'll do face lift, neck lift, of course, the eyelid surgery, nose, rhinoplasty as well. And so we have a special day. This is the only time you're ever going to get pricing like this for eyelids ever here at Pure Plastic Surgery. And that's going to be November 7th. That's the day to get blephed up. And here are the special prices, all right? So, upper bleph, only $27.50. That's it. That's crazy. Actually, I got to talk to her. I don't know. That's too low, I think. But no, it's nuts. Upper eyelids, $27.50. The lower, if you're doing only lower, $3,500. If you're combining both of them, so basically what we call a quad bleph, all 4 lids, at $4,500. That's it. That's ridiculous. Actually, I don't know. I should talk to her. It's too ridiculous. But anyway, that's what it is. If you want to get a beautiful eyelid surgery for the lowest price possible, then sign up for this day, November 7th. Get blephed up on that day, okay? If you guys need more details about that, just let us know. All right? So, happy to answer any questions you may have.
All right, here. Where are you located?
Where are we located? All right, so we are in Miami, Florida. And Pure Plastic Surgery is the name of my practice, our practice. And we are 3 surgeons here total. So myself, Dr. Vidal, and Dr. Wigger.
How likely is fat necrosis?
So fat necrosis, so the question's about fat necrosis, and I'm sure they're referring to fat necrosis
for
after
a
BBL, right? And so how likely is it? So that's going to be also dependent on the surgeon. So fortunately for me, the incidence of fat necrosis is really, really low. I'm talking about 1% chance of fat necrosis. And why is that? Because you don't want to overdo things, right? When you transfer the fat to a new area, it has to basically regain a blood supply so that that fat can then survive and then become like the rest of the fat in your body and act like the rest of the fat in your body. But if you clump it too much altogether, sometimes it becomes very tough for the blood supply to enter the fat in the middle of that clump. And so then that clump basically becomes dead fat cells, which is what fat necrosis means, dead fat cells. And it becomes essentially like scar tissue, right? So you have these dead fat cells, they never got blood supply, so the fat cells died and they just kind of clump together and they form these little nodules that you can feel as fat necrosis. So typically when you're doing the fat transfer, first of all, you don't want to overdo it in any specific area. And once you put in the fat, you kind of want to spread it around to make sure that it's basically getting enough blood supply so that those fat cells can then survive.
Does safe lipo and vaser lipo differ? Do they have to be combined with traditional lipo? I heard a surgeon say safe liposuction is less painful and less downtime.
Okay, so I wouldn't agree with that 100%. Safe lipo is basically just liposuction, okay? What does the SAFE stand for? It stands for separation, aspiration, and then fat equalization, right? So SAFE, separation, aspiration, fat equalization, right? That's basically most surgeons' lipo technique nowadays, okay? So separation means that before you start, sucking, basically, before you start removing the fat, you go in with the cannula, you kind of separate things out so that it's a little bit easier to remove the fat. Then you do the aspiration, which is the actual liposuction part of it. And then at the end, you want to smooth things out. So once again, you go with the cannula that's off suction and you smooth things out, and that's what's called the fat equalization. I wouldn't say that's any less painful than any regular liposuction. It's the same. It's the same amount of pain and recovery and everything else. Now, the one thing you can add to that is the vaser. So the vaser is a separate machine. It uses ultrasound energy, so energy, not imaging, okay? So pay attention to that. It uses ultrasound energy to essentially knock off the fat cells from the surrounding tissues. This is called emulsify the fat. And so it knocks off those fat cells so that you can remove more fat with less bleeding, less inflammation, and because it also disperses some heat, you get better skin retraction. So the vaser, I think, is an awesome device, and for that very same reason, because it makes my life easier and it also is better for the patient, like I said, less inflammation, less bleeding, I use that for all of my liposculpture cases and all of my BBLs. So what I do is basically a combination of the safe lipo with the vaser and also what's called PAL, or power assisted liposuction. So all those things are combined to give you the best result.
What do you think of a tummy tuck with BBL combined and then a second BBL after 6 months?
Okay, so that's a lot of surgery, first of all. So first of all, of course we will have to do an evaluation, see what your long-term goals are, and determine if you need all those surgeries, right? But I do not like to combine a tummy tuck and a BBL. I don't do that combination. I know there's surgeons out there that do, but I don't do that combination because, most importantly, because it increases the complication risk significantly. All right, and as you guys, those of you that know me here at Pure Plastic Surgery, your safety is our number one priority. Okay, we've been talking about safety since day one, since we opened 7 years ago. Okay, so what happens when you combine a tummy tuck and a BBL? Well, the risk for complications such as infection, bleeding requiring blood transfusions, okay, risk of skin dying or skin necrosis, open wounds, and most importantly, the risk of blood clots all go way up, okay? And blood clots can potentially be fatal. So I do not recommend combining those two procedures, and especially here in Florida, because in Florida, we also have rules that are given to us by the Florida Department of Health. And one of those rules states that if you're doing a tummy tuck, you can only remove 1,000 cc's of fat via liposuction. 1,000 cc's is typically not enough to do a whole lipo 360, and certainly not enough to do fat transfer only 500 cc's per side to get the results that you want. So you're increasing your complication profile for crappier results. It makes no sense. Okay? So my recommendation is do your tummy tuck first. Come here, do your tummy tuck first, then 3 months later, do a fairly aggressive BBL, and that way you may not even need that second BBL, right? So you do your tummy tuck and a fairly aggressive BBL, and boom, you're done. 2 stages in 3 months.
Candy said they are great doctors. I already had 2 surgeries with Dr. Vidal, and the second one was with Dr. Earle.
Awesome. All right. Candy, thanks so much for the shout out.
And somebody said, I'm 49 years old. Am I able to get an eyelid surgery?
Yeah, definitely. And if you're going to get eyelid surgery, you better jump on this quick, because this is the cheapest you're ever going to get it here at Pure with Dr. Vidal. So let's see. There's a phone number there. But if you require more information, just send us a DM. Let us know. We'll get you hooked up, okay? But if you can get it on this date, you're going to get a wonderful, wonderful surgery for the best price.
Just J plasma on the thighs, is that possible for skin tightening?
Yeah, so you can certainly do that. So the J plasma and all of these, actually, they can potentially just work on their own, or you can combine them with liposuction. For the most part, we're combining them with liposuction because most patients have some degree of fat that also needs to be removed to smooth out the area. But it can be done on its own as well. So if really most of what's going on in the thighs, that you have some moderate right? Remember what we talked about before, some moderate skin laxity, no excess fat, then we could do J-plasma alone to the thighs. Now, if you have severe skin laxity to the thighs, then we may have to do a thigh lift.
What's the best thing to do to even the hips with the legs?
The best thing to do to even the hips with the legs is to go to a good plastic surgeon like me. That's right. That is really the key, right? You want to go to someone who's not doing cookie cutter surgery, right? Who's actually planning the surgical procedure around your unique underlying foundation. That's what it's all about. And that's what I am all about, right? I'm all about creating what I like to call beautiful, enhanced, natural results. You don't want to have a surgery where it looks like someone just stuck something on there that doesn't belong, all right? And so yes, you got to tailor the fat transfer to the hips. You got to tailor to that patient-specific thighs. You don't want to have huge hips, and then like little tiny thighs. That doesn't look like it belongs. It's not going to age well, okay? So yes, what's the best thing that you can do? Choose the right surgeon and explain to them exactly what it is that you want. You know, you just be very, very open and say, hey, you know, Dr. Earle, whoever it is, just say, hey, you know, I want to make sure that my hips match my thighs. All right, make sure you vocalize that.
Can I pay a deposit even if I don't have enough fat yet for my BBL?
Yeah, certainly it's a possibility, because at least the way that we do things here, once you pay your deposit, you can lock in a date, but that date can be up to 1 year from the deposit, right? So you have time to then gain the weight and just make sure that you reach your goal before the actual surgery day.
What's the max BMI you work with?
So my max BMI is 30. That again is something that varies from surgeon to surgeon. So I know Dr. Vidal, Dr. Wigworth, they'll go a little bit higher in the BMI, I think up to 33.5. So that's good. You know, that's going to change a bit.
How do you know if you should get lipo 360 versus a tummy tuck? And am I able to combine a thigh lipo with lipo 360?
All right, so those are great questions, and actually the tummy tuck versus lipo is a very, very common question that really we get pretty much all the time. All right, and so what needs to be done is that there needs to be an evaluation of the skin and the muscle. Okay, so if the skin has high, moderate to severe laxity, okay, so it's very, very loose, then you should do a tummy tuck. If the skin is anywhere from like no laxity to mild to low moderate, then we can do lipo 360 and consider adding some of these skin tightening procedures. Next part is the muscle. If your abdominal muscles are very separated, what's called a diastasis, then you need a tummy tuck to bring those muscles back together again, because liposuction is not going to do that, and honestly no amount of exercise or hitting the gym is going to do that either. Okay, and the other potential could be maybe the muscles are not completely separated, but they become stretched out and very, very weak. This happens a lot when you have like multiple pregnancies or pregnancy of multiples, like twins and triplets and stuff like that, or if you've gone through very kind of severe weight fluctuations. Okay, so in those cases, the muscles may not be super separated, but they're still very stretched out and weak, so that when you relax, it looks like you're still pregnant, right? And so for those patients, tummy tuck is the way to go. All right, but if the muscles are put together, the muscles are still strong, and you only have anywhere from mild to moderate skin laxity, then yes, you can consider lipo 360, and at that time, yes, you can add the lipo to the thighs as well.
And somebody asked, if you have a C-section shelf, do you have to get a tummy tuck or can you get lipo?
Okay, that's a good question. Do you necessarily have to get the tummy tuck? You don't necessarily have to. I mean, for this, I'm going to say, it's best for you to like fill out the evaluation. Go to our website, www.pureplasticsurgery.com, and fill out the evaluation, what we call the virtual consultation form. So you can send in your questionnaire and your photos, and I can take a look and determine whether tummy tuck or lipo is going to be the best option for you. But if you're having the shelf because there's a lot of just overhanging skin, then typically, yeah, the tummy tuck's the best option. But if it's just a little bit of a shelf because there's a little bit of excess fat there and the scar just happens to be tethered because of the prior C-section, then sometimes just doing liposuction and maybe a little bit of scar release can help smooth that out.
Can a BBL be done with rib remodeling?
Yeah, definitely. Actually, it's one of my favorite procedures right now. And it's turning out super, super great. So you can definitely combine, BBL, liposculpture 360, HD or high definition lipo. All those things can be combined with the river modeling, and that's just gonna bring that waist even smaller. It's gonna really be able to shrink down that waist when we are able to kind of reposition those ribs and bring them in for that smaller waist.
What would you recommend for a man to get rid of a beer belly if the gym isn't working?
Okay, so for guys, a lot of times what happens is that we have what's called visceral fat, okay? And believe me, guys, especially as we start to get older, we start to develop more and more of this visceral fat. And the problem with the visceral fat is that it's not superficial, it's deep. That's why it's called visceral fat, right? There's the superficial fat that's above the muscles, and then you have the visceral fat, which is deep where the organs are. And so in order to get rid of the beer belly, unfortunately, there's not a lot of things that we can do surgically. It really has to do with, with diet and basically changing your diet. And, unfortunately, decreasing the alcohol. Believe me, I love my bourbon as well. But yeah, going way down on the alcohol, making sure that you go, sometimes you need to do an ultrasound, check out your liver because you may have fatty liver. And so you may have to really cut off a lot of the excess, sugars and carbs in your diet to help decrease some of that fat in the liver and that visceral fat. So it's mostly about nutrition and then continuing, of course, with your exercise.
What is the best way to prevent fibrosis?
So in order to prevent fibrosis, it takes, some of it is on the surgeon and some of it is on the patient, okay? So what can the surgeon do? So the surgeon needs to not be overly aggressive. If you're too aggressive with the liposuction and you thin it out, you thin the skin out too much, then the risk of fibrosis and scar tissue goes up. So you always want to leave at least about 1 centimeter of fat underneath the skin to minimize the risk of fibrosis, okay? Now from the patient's point of view, the patient needs to absolutely be compliant with the post-op care. The most important thing that the patient can do to prevent or minimize the risk of fibrosis is their massages. You have to have a minimum of 20 post-lipo lymphatic massages to truly decrease that risk. And then of course wearing your compression with your foams and your boards and your faja. So if you're compliant with that and the surgeon's not overly aggressive, the risk of fibrosis then becomes much, much lower.
Somebody said, thank you, doctor, for not being money hungry and doing operations you don't recommend together.
For sure. Like I said, number one priority has always been safety. I've always talked about it, even though I know other surgeons do it. I don't combine, for example, mommy makeover and BBL. I don't combine tummy tuck and BBL. I want to make sure that, of course, you get back home to your family and your kids, number one. And number two, of course, that you have the best kind of long-term outcomes and long-term results, because this is an investment. And it's a big investment. It's an investment with money. It's an investment with time, right? And so you want to make sure that you're getting the best out of this investment you're making in yourself and your body. And so sometimes it is better to stage things out so you're able to enjoy those results, because they're better and they last longer.
Can I get a BBL and breast implants in one surgery?
Right, so that brings me similar to what we just talked about. So I typically don't want to combine that either, okay? Again, that rule that we have here in Florida still applies. So if you do the breast surgery, then you're limited to how much fat you can remove via liposuction, which is 1,000 cc's. Again, not typically enough for most patients in terms of doing a lipo 360, not typically enough for most patients in terms of transferring that for the buttock and hips, okay? So you're gonna get a less than ideal result for your BBL portion of it. The other reason why you might get a less than ideal result for the BBL portion of it is because now you can't be on your belly, right, on your chest to recover. You have to be sitting or laying down. And so then you try to do things like buying a special mattress and this or that, but you're inevitably gonna be putting some degree of pressure, and therefore you may lose more fat than you otherwise would, right? So you're going to be losing more fat as well, potentially when you combine those procedures. So for all those reasons, I prefer to stage it out. In that particular case, you can choose which one you want to do first. You can do the breast first, come back 3 months later, do the BBL. Or you can do your BBL, come back 3 months later, and do your breast. That's actually my preference. Do your BBL, come back 3 months later, do your breast.
Amazing. Somebody is asking, do you do pannicolectomy, and where are you located?
A hemicolectomy?
Panny?
Oh, pannicolectomy. Yes. All right. Yes. So we do that. Usually, a pannicolectomy is something where you're just removing a lot of the excess skin down here, typically for like our massive weight loss patients. Now, a lot of times we can do that, but usually we just go all the way and do like a true tummy tuck. So not just remove that lower abdominal skin, but do like a true tummy tuck where we're removing the skin, we're doing your muscle repair, your plication, and of course some lipo along the flanks and the waist. But yes, that's something that can be done.
How many weeks are you out of risk for skin infections for BBL?
Okay, so usually if you're gonna see an infection, for the most part, you're gonna see it within the first 2 weeks. Okay, for the most part. Is it possible to see an infection later, like 4 weeks, 6 weeks, or later? It's a possibility, but the risk of that becomes very, very low. Especially after 6 weeks, it's super, super, super low. It'd have to be something very, very strange, like a strange bacteria, like mycobacterium or something at that point in time. So to answer your question, for the most part, over 98% of patients, if you're okay by 2 weeks, then you're okay.
The same lady that asked about getting her Bleph at 49 missed your answer. She's asking if she's able to get a Bleph at 49 again.
You missed it? Oh, come on. All right, you got to pay attention. I did answer your question, and the answer is yes, definitely. You can certainly get your Bleph at 49. And like what I was saying, that if you are thinking about the procedure, you should really take advantage of what the special Dr. Vidal has for this particular day on November 7th. She's going to get you blephed up, and it's going to be the best price that you could possibly have for this procedure, and she provides truly, truly excellent results. So please go ahead and take advantage of that. There you go. Pay attention now, right? All right.
And we are good.
Okay. All right. Awesome. All right, everybody. Well, I really enjoyed that. I hope you liked the little presentation here. As you know, I am here every Wednesday on Hump Day with Dr. Alex Earle, somewhere around 4:30 p.m. So make sure you jot down all your questions so that I can answer those for you. All right? And we'll catch you next week on Hump Day with Dr. Alex Earle. Take care. Ciao.